Over the past years, government has been on loggerheads with the medical internees due to job approvals and endorsements, coupled with a long of habitual deployment crisis. This has created a heated battle across the country, prompting the August House to intervene. However, according to the representatives of medical internees, their outcry has never yielded any fruit, exacerbating the situation and putting lives of Ugandans at stake. The disgruntled team was concerned by staffing gaps and the growing trend of reducing the number of medical internees year in, year out.
Issued invitations to us telling us we should go to our mother councils and apply for licenses, provisional licenses that will be allowing us to do internship. And Ministry of Health is out there creating a notion that they have been given so many graduates that they cannot take in, they cannot absorb into their system. And when they do so, they make someone who doesn't question think that actually we are already safe in Uganda. We have already enough numbers of medical doctors, nurses, pharmacists, and dentists.
So it can't be when they are ready to get deployed that they are being told there's no money, because who is planning and who is responsible?
They demanded for revision and adjustments in policies, among other concerns.
This delay constitutes a violation of the right to health. Every Ugandan has the right to access quality healthcare services, and this right is directly impacted by the availability of adequate medical personnel.
And we have been the shock absorbers for this, the interns. When we come in, we are the ones who cover those gaps. We come in and give services to Ugandans where Ministry of Health can actually not deploy enough people to cater for those services. So when they don't deploy us, it means that leaving lives of Ugandans in a very dire state. It means that there's no one who's going to be attending to those patients who have been surviving on our skills and our providence of the services that we render having studied in universities.
Backed up by a legal team from CEHURD, they threatened to file a suit against the government in response to meeting gaps of medical internees.
So to prevent the reoccurrence of this habitual crisis, we demand the following. One, that the government should immediately avail the funds needed to deploy these medical interns as a matter of urgency for the reasons given above. And secondly, that the government should immediately effect and expand the internship training centers, and we highly recommend private medical facilities beyond the government centers and those private non-profit medical facilities. We know that there are many more medical facilities in this country that have the capacity to accommodate or take in interns.
Deborah Namamonde, Ivan Juko, UBC News.